What I would like to do today is introduce myself, go through a little bit of housekeeping, and then we can crack on with our really exciting program of speakers, and I'll go through and introduce everybody for you at the moment. So what I would like to do to begin with, I'm Wendy Wilkinson. I'm Head of Transformation for Allied Health Professionals with HEIW, that's Health Education Improvement Wales. I'm going to spend a few minutes at the beginning of this session giving a very, very high-level introduction to the Allied Health Professions framework, and then I'm going to invite Ruth Crowder, our Chief Allied Health Professions Officer for Welsh Government, to speak. And then we have a pre-recorded message from Kerry Phipps, our National Allied Health Professions Lead for Primary and Community Care, aligned with the strategic programme for primary care, to speak a little bit about her role. On the call, we also have Lisa Williams, our All Wales Nutrition Training Facilitator working in Cardiff and Vale, and Natalie Elliott, our National Consultant AHP Lead for Dementia, and Rebecca Hammer, Senior Improvement Manager within Improvement Cymru, who are also going to speak today. So without further ado, what I'm going to ask you to do is make sure that you've got your mobile phone or a laptop screen ready. So we've got a few Mentimeter slides interjected throughout the day. Please all make sure that all of your questions, comments are in the side panel. We have a panel discussion later on in the session. We're going to pick up all of those questions and comments in that from the chat bar. Before we go too much further, as well as the chat bar, there are going to be other ways that you can get involved. On social media, please don't be afraid to use the hashtag AHP Cymru. We've also got an Allied Health Professions programme email address. If there are things that come up in the conversation today that you would like more information about, please feel free to email us. And also we'll be hosting a recording of today's session on the AHP page of HEIW's webpage. So before we go into too much detail, we have a first Mentimeter session. So I'm going to stop sharing. So if you can log into Mentimeter for me.
Just sharing my screen now, 1 second. Hopefully you can see that.
That's brilliant. Thank you so much. So everybody, the link is currently at the top of the page.
I'll put it in the chat bar as well.
The link's also in the chat bar. Fantastic. There's nearly 70 of us on the call at the moment, so we'll wait a few more minutes so that everybody gets a chance.
New arrivals, I can share the QR code as well. So use the code if you're new to the session, it's www.menti.com. The code at the bottom, 11557823. Or if you're quite savvy with your phones, you can just use a camera and hover over the QR code, and that'll take you to the presentation to answer the questions.
Brilliant. It's really exciting to see that so many people are familiar with the framework already. A couple more seconds and then we'll move on to the next question. So given that the significant majority of us are all familiar with the AHP framework, we'll move on to the next question. I think there's a couple of overall winners there, isn't there? Time and competing demands, especially in the last 18 months. I think never before have we been in a situation where we're being asked to be so forward-facing and so transformative, whilst we've got so many other things on our plates that we're trying to juggle. So thank you so much. What we'll do is I'll try if we can, and I'm going to say this, but I need to check with Joe, but it would be really great to think that we would be able to continue having this link live on the AHP page, so that as people read more about and watch the sessions in playback, that they would also be able to add their thoughts to the ongoing session and the ongoing discussion. So that's fantastic.
Yeah, I don't see it be a problem, Wendy.
Brilliant. Thank you so much, Joe. Great. Can I share my screen again and we'll crack on. Brilliant. Fantastic. So this makes my job really easy, actually, I think, today, because actually, largely, today's going to be about all of the fantastic stories that everybody else has to say about the Allied Health Professions Framework and how they're working towards the delivery of the vision that's described in the framework. So all I wanted to say was, of the 6 themes that are in the framework, one that is really resonant at the moment is around accessibility and responsiveness. We want to make sure that AHPs aren't hard to reach. We want to make sure that our public can find the right allied health profession to meet the need that they have. So this is the reason why the theme of today's session was about access, accessibility, and responsiveness. Very, very quickly, how did we get from having this really, really complex document to where we are now, where we're trying to actually implement a program of work to make this vision a reality? How do we translate, I guess, that really high level, innovative aspiration, I think is the kind of word that I'm looking for. And it started around October time last year, when Welsh Government asked HEIW to take the framework and translate it into a program of work. So we did this by organising the framework by theme, looking at what's already been achieved. We know the framework was published at the end of 2019. There's already work that's been achieved in the period of time since then till now. There's been so much policy and strategic drivers come out in the last 18 months also. And I think what's been really important is to make sure that any of those aims or visions that we have for the AHP framework are in line with our quadruple aim from A Healthier Wales, which we know it was because it was written in response to prudent and value-based healthcare, but also we have the new health and social care workforce strategy, and there are 7 key themes within the strategy. So we were making sure that they're all moving in the same direction also. And lastly, the National Clinical Framework. So this particular framework is really exciting for me because I think it offers us really exciting matrix working opportunities. And that's not just matrix working within specialties of professions or between professions, but this is a multi-organisational, multi-care sector opportunity for us to really transform that whole system approach to how AHPs are meeting the needs of the general public. Over the last 12 months, we've engaged in a quite pragmatic approach to stakeholder engagement. So this is our first formal, I suppose you would assume, our first formal stakeholder engagement event. But actually, that doesn't mean that we haven't been listening. It doesn't mean that we haven't been paying attention to the challenges that are being faced out there in the service. It doesn't mean that we're not cited on some of those difficulties that you mentioned in the previous Mentimeter slide. But also, it means that we're cognizant of the fact that engagement is going to be so much more challenging than it ever has. So we're looking forward to, over the next 6 to 12 months, coming up with a coordinated communication strategy for how can we make sure that all of the information that is within the framework, all of the actions, everything that's happening is actually available for you to read, follow, but participate in. This isn't a spectator sport. The AHP framework is a game that we can all play. So a couple of the key ideas that I really want to shine a spotlight on. AHPs in rehabilitation have never had so much of the front line as they have in the last 18 months. And I think that that's amazing. But from the AHP framework, I think it's really exciting for us to think about our role in supporting population resilience. There is a fundamental shift here from being reactive to becoming more proactive. This is about stopping those centralisation of services and being more accessible and more local. This is the first time I've ever hosted a webinar, so I think this just goes to show how we are all embracing and using digital technologies like we never have before. There's some exciting outcomes from some of the work that Tech Cymru have been doing around the virtual consultation work, and I think that just goes to show how engaged AHPs are in adopting digital technologies and new ways of working. And I think one of the final things that we're trying to achieve is how do we actually clarify some of these career pathways and our leadership opportunities so that we know exactly how we can get through and navigate those pathways and career options. I think there are so many more opportunities now than there ever have been. This slide is a summary of all of the objectives, a very high level objectives. And basically it reiterates those key themes. We want confident and effective clinical leaders at all levels. This isn't just about senior professionals. This is about everybody. We want integrated models of practice. It doesn't matter what the theme or specialty is. It's about how do we integrate health, social care, leisure and community resources. This is about using quality improvement methodologies across everything we do and making sure that our support worker workforce are engaged and are supported to be as adaptable as they possibly can be. In HEIW, I guess we have the responsibility for ensuring that people have access to the education and training opportunities that they need. And we know that there is an awful lot happening out there across many organisations around making sure that we've got access to the digital tools. There's a lot of conversation about how we've done things new and different in the last 18 months. And I guess we're looking to harness how we can continue to do new and different using those alternative workforce models to look at what the future of allied health can be in Wales. And then ultimately, because we're going to be incredible, we're going to be one of the most attractive career options in health in Wales. So can I please ask you to return to your final Mentimeter slide for this particular section of the session, because I really want to know what is it that you need to overcome some of those barriers that you mentioned earlier? How do we do that? Everybody's already a step ahead of me. So looking at some of those responses there, there's conversation there about clearly time and perhaps job planning and helping to carve out some of that time that can be spent on quality improvement activities. There's guidance in there. There's another comment around leadership, having a strong voice, being able to network with peers and colleagues, sharing and simplifying processes. And that's fantastic. So I'm going to I think all I wanted to do at this stage was reiterate, please stay engaged and participate. We've got the hashtag that we can use on Twitter. There's also the email address and the pages on the website. Now, it is my absolute pleasure to invite Ruth to talk to us about where the AHP framework fits in relation to the wider context in Wales.
Thank you very much, Wendy. So I will attempt to share. Oh, look, it worked. This is all very pleasing. Fiona will be hugely relieved. Right. Are you able to see that?
Yeah, coming through.
Marvellous. I now can't see anybody. I can only see the slides. So I'll just talk and assume that you haven't all closed your eyes and gone to sleep. So thanks, Wendy. Absolutely, and fantastic to see so many people here and such a positive number of people at least already aware of the framework. And I guess I want to start by saying many of you would have been involved in its development such a long time ago and almost in what feels like a completely different world. So last month we had a new election, and I thought I would just begin by sharing some of the highlights with you from the new programme for government. Wendy's absolutely right. The recognition of how important AHPs and our skills have been throughout this last 15 months are very widespread. The way in which you all stepped up and drove change in order to make sure that we could continue to deliver the best that we could was well recognised. And the Tech Cymru Innovation Report published last week absolutely illustrates that. So we have a new minister, a new ministerial team, 3 ministers, a minister and 2 deputy ministers. And the programme for government, I've literally just picked out a few of the key points here, which I think most particularly relate to us as AHPs. So the rehab framework that we published last year identifies those 4 populations, and one of the key priorities has now got to be helping those people who have had their treatment delayed by the pandemic, people who are currently in pain, not able to get the access to some of the treatments that they might need, and how we as AHPs use our skills to ensure that we are accessible and responsive to those people, that it is not good enough to just leave people sitting on waiting lists, waiting for treatment that will now potentially take some time, that we are actively managing people, we are providing advice, we are enabling them to self-manage. Another key priority in the programme for government is about delivering better access to health professionals. And that I think really underpins how our framework fits into this programme for government. How are we going to ensure that people are able to get straight to us? First contact practitioners, our placement in primary care, our work in other programmes such as Flying Start, all of these things that are changing the way people can reach us, our use of technology, etc. So we've got to make sure that actually we're not inadvertently adding to the distress of people by placing them on waiting lists before we actually get round to triaging whether or not they're waiting for the right person. That where we're able to provide them advice about self-management, and meeting their own needs and taking actions that will help improve their health and well-being and prevent ill health, that actually they're able to get to us very quickly. And I want to add into that, this isn't particularly detailed in the programme for government, but I want to add into that maybe we also need to think about our 9 to 5 access as well. 9 to 5 Monday to Friday is not helpful for those people who are able to work and have been able to retain their roles, but is actually something that we need to think about. And some of our professions already work 24/7, many of you working extended hours, but access is about speed to getting to the right person, and it's about timeliness, and it's about the quality of that response. So you'll like the third bullet point here, a very clear commitment in the programme for government to reform primary care, to make sure that we are bringing together all of those services in primary care, GP, pharmacy, all of our therapy, wider AHP, housing, social care, mental health, community and third sector, to really continuing to drive that sense of integration. A clear commitment to prioritise investment in mental health, to support innovative housing development to meet care needs, to continue to support family where parents are in education and training, to continue to support Flying Start, and then to use the new network of Disabled People's Employment Champion to help make sure that we close the gap between the proportion of disabled people and the rest of the working population able to work and achieve their outcomes. All of that, I think, helps to show that we continue to have that same direction of travel that we've had before, that all of those priorities about reducing inequalities, maximising people's health, ensuring that people are able to reach the services that they need as quickly as possible so that they are able to live as well and as happy, healthy and long lives as they possibly can. So you'll be unsurprised to know that we continue to use A Healthier Wales as our plan for health and social care. So that vision to enable everyone to remain active and independent in their own homes for as long as possible, to shift that focus of our health and social care services on health and well-being and prevention of ill health, to really continue to drive forward that whole system approach to health and social care, and to ensure that we deliver as close to home as possible and shift services out of hospital into communities. Hence that priority around primary care. So what is really critical in order to do that is to make sure that our services are designed around the individual, based on what matters to them, and on really high quality and safety outcomes and value-based care. Really important, I think, to just pop back to that services designed around the individual. It's really easy for us to think that because we've got services that are slick and efficient and work for us, that those actually suit people. But actually we know that many, many people tell us it feels a fight to get what they need. It feels hard to navigate the complexity of our systems. If any of you as healthcare professionals have been a user of the service, I'm sure you'll know what that feels like. But there is something that we have to do if we're truly going to tackle access and responsiveness, to look at what we mean when we say it's designed around the individual, or whether in fact we're continuing to design our services around ourselves and our efficiency. And efficiency is important. We have a requirement to make best use of our resources, but not to ignore the fact that if that makes that more challenging for people and more of a struggle for them to get the care that they need, that actually the quality, experience and outcomes are going to be affected by that. So Wendy mentioned the National Clinical Framework. This is identified clearly, as the National Clinical Plan in A Healthier Wales, so it's had a change of name. And I have a slide at the end of this with all the links. So hopefully you will be able to find these documents really easily. So the intent is to carry on the A Healthier Wales commitment for a National Health Service Executive. And that is intended to incorporate the existing national networks and programmes and support units. And then the intent is that it will use those to transform clinical services in line with our national priorities. So the proposal in the National Clinical Framework is that we will have nationally agreed service. I didn't think I'd written this. I thought I'd cut and paste it. So I think that's specifications, but we'll go with innovations for now, because we do need to look at what are the innovations as well as the specifications of our services. So when you go and look at this online, you'll be able to see whether or not I've made an error on that. And we also need holistic pathways of care. So it really is about thinking about putting the person at the centre and making sure that their experience is of a joined up, integrated service. And not thinking about episodes of care, but thinking about the whole pathway. And for many years, many of us have talked about wanting to be in primary care and recognising that primary care is where we may be able to offer our most effective interventions. And that is not about seeing someone because they've been admitted until they're discharged and then getting rid of them. It is about that whole pathway of care, lifetime support, understanding that person in their context. And that's something I think we're going to find very exciting to embrace, because I think that really aligns with our philosophy as AHPs. So the plan is that we will be developing quality statements. Some of these are already in place, and there, as you see, they will be underpinned by service specifications. So population health approach to planning services grounded in the life course approach. And I think this is where our integrated health boards really come into their own. We need to stop talking about primary care or secondary care. We need to start understanding that health boards have a responsibility for the whole of population health, and thinking about the way in which we are able to run our AHP services that move across that. And I don't want to tread on Kerry's presentation, so I won't say too much more at this point, but I think it's really important that we think about how we support people where they need support, irrespective of what our apparent location of employers. And our health boards, regional partnership boards, integrated community services will help us do that. So the focus for the National Clinical Framework is on a learning health and care system, that we look at quality assurance, quality control, quality planning, but most importantly, that quality improvement, and that we are continuing to function in a learning environment that allows us to make sure that our population planning is as informed as possible, that we're able to localise those pathways, and to ensure that each and every single one of us understands and abides by our duties of quality and candour. Because the outcomes that we're looking from this are high quality, patient focused services that are delivered consistently across Wales. I know there are really exciting innovations in all of your services, but it does disappoint me when I see that every single health board has developed something, but actually not joined up as well as we could have. And I think if we really are looking at quality improvement and we're looking at a learning environment, what do we do about making sure that it doesn't matter which health board you live in, you know that you will be getting those high quality patient focused services because they are delivered consistently across Wales. And so those national programmes and national networks are going to be responsible for making sure that we have that communication that helps us drive the quality and outcomes here. And the planning framework and performance management system will change undoubtedly in order that we will have that national oversight of delivery and ensure that we are moving towards that continually improved service delivery. So the elements in the National Clinical Framework, quality statements, the pathways, the clinical networks, and the national programmes. And one of the last lines in the National Clinical Framework is, don't wait to be told. This framework is your permission to act. And I always like that kind of approach, because actually I think AHPs do act, and you have been acting and you have driven change. I guess the framework might be the permission to act, but really now is our opportunity to make sure that the rest of the system sees what it is that you've been delivering and changing. And I think really the last year has done that to an extent. People started to see just how important and effective our interventions are. So hence the link in terms of the Allied Health Professions Framework for Wales, which is going to allow us to actually move into this field. The clinical networks, the AHP network that's identified in the AHP framework, and the plan for a programme, as Wendy's just outlined, all needs to be feeding into your contribution to the quality statements and ensuring that we have those life course pathways that have allied health professionals through every single element, not just after someone has had a hospital admission, not just before they come in, but at every single point where it may be important for people to access those services. And I just wanted to remind us of the definition of quality and value, because value-based care remains the key to delivering this kind of an integrated health and care system. At its core, or maximising for value for patients. And that is about achieving the best outcomes at the lowest cost, underpinned by evidence and continuous learning. And really pleasing, and I know some of you are actually on today, Natalie, I've already seen your photo. So Improvement Cymru strongly advise you to go and have a look. Rebecca and Rupert working there, delivering significant impact, and our brand new AHP Quality Improvement Connectors, 3 for Wales, Rupert, Natalie and Rob. So really important resource, and really, really pleased to see the 3 of you in place on top of your day jobs. So Wendy's already shown this, the 6 themes of the AHP framework, this one focusing on accessibility and responsiveness. I prefer her hand-drawn circle to my rather boring clip art arrow, I have to say. And we've framed the quadruple aim within the AHP framework in this way. So today, I think we are focusing on number 2, a rather bright yellow slide, for which I apologise. But if we are truly going to enhance the quality of and access to AHPs, then we need to be ensuring the highest quality, safety and accountability of services. We need that direct, timely access to AHPs. So what do we need to do about direct access? What are we doing about referral? How are we thinking about the inclusion and exclusion criteria? How are we thinking about triaging? What are we thinking about our waiting list? What are we thinking about a discharge? All of these things have got to be thought about, because without tackling those bits of the system, we won't be able to create the capacity for direct, timely access to your skills, so that you are able to enable people to live as well as possible, for as long as possible in their own homes. And I think it's really critical that we ensure that this is all based on evidence-based practice, that we reduce that variation and risk of harm, and that we hold ourselves to account to improve quality and outcome for citizens. That we ensure we are generating and using research data. So the National Informatics Data Board, the AHP activity research that's underway at the moment, the need to look at how we're identifying what it is that we're doing and providing data in terms of Welsh PAS and WCCIS are all critical. And before I move on, I just want to remind you, this quadruple aim and this framework was developed with extensive engagement from many, many hundreds of you and our colleagues in Wales. So these are things that you came up with nearly 2 years ago now, and they still hold very true. And I'm really excited that we're going to be moving now to a point of starting to implement the programme. Again, don't worry, Lisa, I'm not going to say much about this, but built into the AHP framework is the need to deliver the goals of the Public Health Strategic Framework. And this is a really clear, strong message. Timely access and prevention have got to be based on taking that population health approach, looking at the earliest point in which we can actually intervene or create the conditions where people can ensure that they live as healthy and active a lifestyle as possible and maximise their health and well-being. So really excited to see that connection. So for me, really exciting times. I think the message in the National Clinical Framework and the National AHP Framework and in the programme for government is we really must not miss the moment. We must not get left behind as AHPs. This year has really demonstrated the challenges of our system in terms of how it does leave behind some of our population, dealing with health inequalities, ensuring that we are actually pulling everyone together to have the best, most equitable opportunities of living as well and healthy and long and happy a life as possible are absolutely critical. So I'm really looking forward to the rest of this afternoon, but I'm really looking forward to the next 2 years as we drive forward the implementation of the programme. So thank you ever so much. As I say, the final slide's got the links. So I am assuming that that will be circulated with you in a moment. As soon as I can work out how to stop sharing, that will be wonderful. Have I stopped sharing? Because I can't see it anymore.
Thank you so much, Ruth. Yes, you have stopped sharing.
Fabulous.
Fantastic. Thank you so much. And I think it's really interesting, some of the points you're making about working together and joining services up. And, you know, there's this thing around direct access and prohibitive referral criteria, and how can we use a more person-centered approach. Yes, it's great having slick and easy access service provision, but are they meeting the needs of the people that of the people of Wales? So I think without further ado, Kerry's very kindly pre-recorded her presentation, so I'm going to introduce Kerry Phipps, who is the AHP lead for the strategic programme for primary care, and she's going to talk to you a little bit about some of the work she's doing within primary care.
Afternoon, everyone. I'm Kerry Phipps, and I'm the National AHP Lead for Primary and Community Care. And I'm thrilled to have the opportunity to talk this afternoon with you all on the importance of AHP accessibility and responsiveness concerning the developing primary and community care policy and the vital role this plays in terms of AHP transformation as we move forward into reset and recovery. To provide some context in Wales with regards to primary care ambition in terms of the developing AHP offer in primary care, meaning in its widest sense of primary and community care, not just general practice, the four nations are slightly different in approach in terms of accessibility and responsiveness. England, for instance, has a general medical services or GMS sustainability focus and is developing a specialist primary care pathway of services to release GP capacity with a role reimbursement scheme of pre-approved professionals with advanced clinical practitioner skills. And this is what's informing the Health Education England Centre for Advanced Clinical Practice and profession-specific or multi-professional, in the case of MSK, primary care credentialing frameworks for Band 7s and 8As. In Northern Ireland, they have a designated multi-professional team reimbursement scheme. And in Scotland, whilst initially taking profession-specific approach, they're much more aligned to Wales now, focusing on the required AHP skill set to meet population needs. So in Wales, our focus is on a responsive primary and community care, seamless and organised around the needs of the individuals, with prevention and wellbeing across physical and mental health fundamental to how we rebuild services and deliver care, with a multi-professional approach essential to meeting people's needs, ensuring that they can access the right person at the right time in the right place. With AHPs viewed as a vital component to delivering high quality care and improving health outcomes, especially with regards to supporting self-management and adopting a preventative, anticipatory approach to delivering support. Recommendations echoed in the recent Welsh Government's programme of commitments to tackle the challenges that we face and improve the lives of people across Wales, with whole system, whole lifespan pathway approaches with localised delivery according to population and workforce characteristics. So primary and community care being the place where we are predominantly located. So if you only remember one thing from my session today, then this is what I would want it to be. In terms of primary and community care, we need a fundamental shift in our current culture and behaviour in order to truly transform our offer and respond to the challenges ahead. So for instance, as AHPs, we currently complete our training and we start work and we're looking to apply our skill set. And then in the context of where we're working and our role, we sort of say, all right, I get it. This is what I do and this is where I do it. and we seek the key piece of information to meet the criteria that enables the person who's contacted us to access us and our service, or that piece of information that enables us to move them on to someone else or somewhere else. So, oh, you're struggling with MSK pain, but you've got dementia, so that's not me. Now, I know I'm being divisive in my language, but you'll understand my message. So as opposed to, this is my skill set and this is how I can use it to support you with your needs in an accessible and responsive way. And if you need additional support, I'll enable that to happen without people being ping-ponged between services. A little bit more context here, but I think this is a really key message going forward. Just to bring it, I know the slide's up, so just to bring some context into it, in the Parliamentary Review in 2018 set out the case for change in health and social care provision, describing the need to bring services seamlessly together, designed around the needs of individuals with a greater emphasis on keeping people healthy and well. And A Healthier Wales was the response to this, and sets out the intention to create new models of seamless health and social care with the primary care model, the nationally agreed approach to achieving this, changing the focus of care from hospital-centred to a place-based approach, with core principles of planning care locally, equitable access, sustainability, improving quality, a skilled workforce, and strong leadership as its centre. Clusters are central to this place-based model. Now, it's fair to say that when clusters were first developed some 10 years ago, the main thrust of that development was focused around GMS sustainability, which meant that a lot of the AHP pace setters in primary care focused on GP capacity release in terms of key value and impact. Now, the main thrust going forward now is about achieving the primary care model. So where a cluster-led collaborative of services, including AHPs, will continue to develop models of seamless local partnership, working closely with regional partnership boards to promote transformational ways of working so that they're adopted across Wales. So regional partnership boards, or RPBs, again set up in response to A Healthier Wales, are the lens by which ICF, transformation funds are viewed and the conduit by which they're sort of applied for and approved. And clusters, to be fair, have been slightly on the periphery of that and have been focused around that first sort of phase of thrust around GMS sustainability. And moving forward, it's about bringing these together. So a fundamental principle of the primary care model is building the resilience of individuals and the support they can get from their communities. And moving through this year and next, this paper by the King's Fund is key. It identifies that a successful and sustainable recovery is possible if there is investment in the resilience of communities and community-led approaches, that there's a conscious focus on collaboration across agencies, organisations and services, and on building greater community resilience and recovery by enabling individuals and communities to be in the best possible health to cope with what comes next. This is consistent with A Healthier Wales, at the heart of the primary care model for Wales, and a locality or cluster planning and delivery model. This is what's informed the strategic programme for primary care strategic priorities, the programme that I'm allied to, with the cluster development programme focusing on bringing the wider stakeholders in a cluster together to consider the health and wellbeing needs of the population and the assets, moving on to that phase 2 that I spoke about. So those assets that are available and required in the local community, making the most of expertise, capacity and the potential of people and families and communities in delivering better outcomes and experiences. The Community Infrastructure Programme of Work underpins cluster development and looks to create collaborative working across professions, agencies, organisations and services within the community infrastructure setting, building greater community resilience and recovery by enabling individuals and communities to be in the best possible health to cope with what comes next. And this gives you a visual representation on how the cluster planning group could look like. So you can see AHPs absolutely core membership. So if you go back to not what we do and where we do it, but what's our offer and how can we apply it, this is about population needs and not professions, with a focus on the skill set required to meet those needs that then would be applied against workforce requirements in the context of that localised geography. So this builds on that, because not one size fits all with regards to developing teams across cluster-led planning and delivery. And instead, what we need to focus on a requirement for direct access to a wider range of AHPs and skilled AHP practitioner roles, assistant practitioner roles, as part of the continuum of primary and community care. So a generalist specialist approach with increased specialism knowledge in the wider workforce, not just specialist roles. So an application of a team Tetris framework comprising of informed, skilled, enhanced and expert, that could be mapped against local population health needs, with digital utilisation to support multi-professional collaboration and communication, both on an individual and group basis. You see that picture starting to build up? With resulting models of care developed that best meet those needs in the context of workforce and geography. Recognising that work streams are not isolated in terms of how we meet the needs of our population groups and competing priorities. So we think about urgent primary care, COVID recovery and rehabilitation, people on paused or cancelled waiting lists, our population's mental health and well-being. And I've put in the diagram in the slide there, the National Clinical Framework that's just been launched. How do we do whole system, whole pathway approach across diagnostic pathways, delivering symptomatic interventions to meet people's needs? So notably, prior to the pandemic and throughout the pandemic, AHPs across Wales have been utilising their skill set across primary and community care in new and innovative ways, often in new and unfamiliar settings where they've been able to utilise and apply their unique skill set. And certainly the flexibility, creativity, innovation and leadership shown by AHPs across primary and community care, crossing traditional boundaries, has been recognised as fantastic. The main themes relating to AHPs certainly can be categorised in terms of leadership, which definitely needs to be present, strengthened and supported. If we think about cluster-led collaboratives and RPBs, supported at these respective forums as part of primary care transformation, communicating our offer, articulating the value of our unique skill sets. Understanding the AHP offer is absolutely paramount to our effective utilisation, and a clear message coming through has been that the lived experience of AHPs in unfamiliar areas cannot be overestimated in terms of understanding of their offer, impact and value, and therefore informing optimisation of our skill set. As AHPs, it's imperative that we apply our full skill set to presenting needs instead of a more traditional utilisation framed by a perceived or designated role and the environment in which it operates. As I've already said, this is pivotal to supporting collaborative decision making, informing priorities and prudently allocating AHP resource. Ease of access to AHPs in primary care is actually a recurrent issue cited in terms of reported barriers experienced to reaching the right AHP support within an appropriate timescale. Now, I know this is influenced by rising thresholds of criteria to access AHP resource and complexity of the referral process. Demand and capacity outstrips our workforce resource. But what's important to remember is that about 80% of the population are supported in primary and community care, and conversely, only about 20% of us, AHP workforce, are in this space. So this means that people have to effectively deteriorate in order to meet a threshold of criteria to access us. And then we say, if only we'd have seen you sooner. I make no apologies for that. a lot of you will probably have heard me say that phrase quite a few times, but it's sort of, we need to keep repeating it in terms of how we shift our culture of thinking and behaviour. We need to think about the utilisation of our skill set in terms of applying it in unfamiliar ways, articulating its value and impact in order to deliver quality outcomes and upskill and train others as well. Finally, it's about how we shape the way forward, building on all of that. And there's examples across Wales where we've articulated our offer, and our offer has provided accessible and responsive services, influencing now developing policy in terms of how we optimise support and develop the AHP workforce to meet population need within the context of workforce and geography. Some examples here in terms of innovative ways to how we've applied our work, our skill set to support the population and keep them well. And as I've already said, the pandemic has led to significant AHP innovation and transformation across primary and community care. Examples of mental health services redeploying occupational therapists to support an anticipatory approach for those who've been shielding and identified as having decreased levels of activity and social connectivity. There's been the delivery of a bespoke virtual parental wellbeing intervention group focusing on child and family topics identified by the group such as childhood anxiety, behaviour management and parental self-care, targeted at parents of primary aged children and run in collaboration with primary care providers and education. We've developed self-management resources, obviously including the COVID recovery app. We've embraced technology with regards to webinars, apps, banks of video clips and easily accessible information, with AHP as a predominant user of video consultation in terms of individual and developing therapeutic groups. Notably, the latest Tech Cymru evaluation identifies that there was over 9,500 respondents by AHPs, including about 3,800 clinicians and 5,700 patients or people who've been supported by services. We've led on developing multi-professional single points of access and triage, along with application of taxonomy in terms of enabling those with greatest need being prioritised and supported. We've provided resources to individuals with dementia and their carers, offering advice and assistance on coming to terms with the changes in personal environment arising from the pandemic, and being key to early supported discharge, post-stroke interventions, extended staffing capacities across 7 days to provide clinical delivery, including management of new referrals and assessments at weekends. We've upskilled and trained others, dietetic support, optimal way to manage the nutritional needs on respiratory, optimal ways to manage that. There's so much, isn't there? You can tell I'm getting tongue-tied. Respiratory management, anxiety management, early rehabilitation management, delirium, wellbeing strategies, cognitive reviews. We provided a fatigue management toolkit, as well as advice and equipment to support single-handed care into care homes with high levels of sickness. Importantly, we've also led and been a crucial resource with regards to supporting the workforce's psychological care and wellbeing, and shaping the way forward in terms of modelling resource, in terms of a healthy work in Wales and the AHP skill set in supporting people to remain or return in work, and the understanding of the use of the AHP Health and Work Report is now informing discussions with regards to wider professions being able to sign the FIT note, learning from our transformation in terms of service delivery. We've got examples in terms of speech and language therapy, working across South Wales regarding communication devices, resulting in improved parental engagement, co-production, reported experience and outcomes, learning from our workforce's experience and adaptations and future thoughts, critical to going forward. And we've got examples with an IMBEV and physiotherapy. And unsurprisingly, AHPs are currently the major contributor to the Tech Cymru work on the strategic benefit of video consultation to ensure that the clinicians are well set up at home, to ensure that the successful rollout of VC can continue post-pandemic to its best ability. We're not just filling the gap. It's about articulation of what we do, articulation of our skill set and our offer, not just what we do and where we do it. And this is a great example that captures some of the main themes outlined today. David, who's front and centre top row, is the clinical lead AHP in podiatry and wider services in Swansea Bay. And in response to the Coronavirus Act and a request by his Director of Therapies to review the Act and identify what support was needed in the community in primary care, he identified that there were two aspects to consider: ensuring the capacity for good bereavement and quality of care after death, and to fill the governance gaps created by the Act. He formed a team of AHPs and healthcare scientists who put into action a 24/7 verification of death service using the board's care after death pathway. They have ensured timely verification of death certification, arrangement of funeral director and mortuary services and remote registration, and most importantly provided emotional support, mostly in care homes. The service is underpinned by a comprehensive policy, role profile and in-house training programme, cited and shared by Welsh Government as an example of clear, strong governance, with the team providing invaluable emotional support to those affected. Standardised bereavement support is provided verbally and in the form of a bereavement pack, and the bereaved are offered immediate referral to the board's psychology and chaplaincy-led bereavement service for triage within 48 hours of referral. A second invitation for bereavement support is made 4 weeks after death to those who initially declined referral. This service optimises AHP and healthcare sciences, nursing, paramedic and medical capacity, and to date, over 270 GP hours have been released by the service with an average response time of 47 minutes, and have delivered training workshop and competency sessions to 36 community nursing staff. The service was recently included in the National Advancing Healthcare Awards Gallery as a team who are doing outstanding work that highlights the contribution of AHPs, healthcare scientists and those who work alongside them during the pandemic crisis, and in recognition that this wasn't just about filling a gap, but taking unique AHP skills and transferable expertise to improve experience and outcomes of others. The service is continuing to develop and remain, with David awarded an MBE for services to NHS and the bereaved during COVID. I know I've spoken a lot during this session, and unfortunately I can't be with you to sort of cut it up with regards to questions and have more of an engagement. But importantly, given the requirements of whole system pathway working and the impact of COVID across population groups and alternative ways of working required to deliver high quality, sustainable health and social care going forward, there has never been a more important time for us to optimise our offer across primary and community care. Really articulate what's our skill set and what's our offer, and shift away from what we do and where we do it. Many thanks again for the opportunity to talk this afternoon on the importance of AHP accessibility and responsiveness in primary and community care, and the impact that this is having in terms of developing policy and the vital role that we play going forward, shaping a preventative, proactive, whole system approach. Diolch yn fawr.
Points there about our offer, and there's been some great conversation in the chat bar about misinterpretations perhaps of what our offer does look like, and what some of those historic perceptions are. And I think Kerry raises a really interesting point. Our offer isn't just about what we do and where we do it. It's about that potential. It's also about that thinking differently and harnessing the power of the if we'd only seen you sooner. And that brings me on to introduce Lisa Williams. So Lisa is our All Wales Nutrition Training Facilitator at Cardiff and Vale. And today, Lisa's been asked to talk to you a little bit about the Public Health Strategic Framework, and perhaps give us some examples of how that looks in practice. Thank you, Lisa.
Great, thank you, Wendy. And good afternoon, everybody. Prynhawn da. Really pleased to be able to talk to you today about the Public Health Strategic Framework. So I'm just going to try and share my screen and hopefully things will work. Fingers crossed.
Yeah, that's come through.
Okay, can you see that? Okay.
Yep.
Great, lovely, thank you. So good afternoon, everyone. Again, I've got my slides in front of me. It's I've got the notes there as well now, so we're off hopefully. So yes, as Wendy said, I'm a public health dietitian. I'm based in Cardiff and Vale University Health Board. I'm also an All Wales National Training Facilitator, and I chair the AHP Public Health Strategic Framework Implementation Group in Wales. And this is our vision and ambition. So our vision is that AHPs will improve population health. Public health will be a core element of all AHP roles, and the impact of AHPs on the population's health and reducing health inequalities will be increasingly recognised. And our ambition is to be recognised as an integral part of the public health system. So we are part of the wider public health workforce. We account for 25% of the clinical workforce of NHS Wales and have hundreds of thousands of contacts with the public every week. We work across NHS, social care, education and third sector, and we work across the life course in a wide range of specialities. So we're well placed to be public health practitioners. Now, you've heard a lot about the national drivers and policies for promoting wellbeing, preventing illness and addressing the widening inequalities in health. So we have the strong legislative framework in Wales with Wellbeing of Future Generations Act, and it has long-term wellbeing goals, one of which is a healthier Wales, another is an equal Wales, but a healthier Wales where health is maximised and where choices and behaviours that benefit health are understood. We also have a Healthier Wales, our plan for health and social care, which sets out the long-term vision of a whole system approach to health and social care. Apologies, I'm having accessing these. And then the programme of government that Ruth mentioned, provide effective, high quality and sustainable healthcare, investing in post-COVID recovery and tackling those health inequalities, improving mental health provision and focusing on prevention. We've also heard about the National Clinical Framework, which advocates a life course approach and the importance of partnership working to address the socioeconomic determinants of health. And it says further effort is needed to reduce the burden of avoidable ill health on people and the NHS. And in the framework, the Allied Health Professions Framework, the strategic response to a Healthier Wales from AHPs, it recognises that the workforce will need to be rebalanced to provide more care closer to home with a greater focus on public health and health promotion. But thinking about COVID-19 and what we've all been going through in the last 12 months plus, COVID-19 has been described as a syndemic pandemic, so interacting with and exacerbating existing inequities in chronic diseases, as well as the conditions in which people live, work, grow and age. So that gap in healthy life expectancy between the most and least deprived communities in Wales, which is 8.2 years for men and 19.1 years for women, is impacted by these wider social determinants, including education, housing, unemployment, food, work, environment, as well as access to services in healthcare. But we must take into account those wider social determinants of health in everything that we do. And so, as we all know, that the COVID-19 has really exacerbated and laid bare these long-standing socioeconomic inequalities and inequities in our society. And we know that for many of those chronic diseases, such as heart disease, obesity, type 2 diabetes, these determinants can work together to contribute to ill health and increase health inequalities throughout a person's life and can negatively impact upon the next generation. We've seen the Marmot review of pre-COVID of February 2020, looking at how health inequalities have increased over the last 10 years. And this was followed up by a report in December 2020 detailing how the pandemic has had the greatest impact on people already experiencing inequalities. And last week, the King's Fund published its framework to support any AHPs to understand their contribution to tackling health inequalities, whatever their role. And the framework details how AHPs can take action through 6 lenses. So self, patients, clinical teams, pathways and service groups, communities and networks, systems, and nurturing the future. And there's also the Public Health Wales Health Equity Status Report Initiative. So on the right there, Public Health Wales is a WHO collaborator for investment on health and well-being and reducing inequalities in health. And it produces resources and information to support the rephase. So that is worth having a look at. So with our UK AHP public health strategy, this sets out our approach, vision and goals, and it builds on previous strategic documents for England back in 2015 and Wales in 2017 to provide a united collective approach across all 4 nations. So some of you may remember we had our first Wales strategy and we had a workshop at an AHP conference and a launch event in the Brangwen Hall back in March in 2018. And Scotland and Northern Ireland were keen to have to develop similar strategies, and the benefits of joining up to share good practice and to have one overarching UK strategy was realised. And this resulted in the launch of the 5-year UK AHP strategy in 2019. So the goals, you saw this infographic earlier, Ruth put this up. So the goals are developing the AHP workforce, demonstrating impact, increasing the profile of the AHP public health role, strategic connections and leadership, and health and wellbeing of the workforce. So with developing the AHP workforce, we'll have the skills, knowledge and behaviours to promote, improve and protect the health and wellbeing of individuals, communities and populations. We'll be able to demonstrate our contribution to improved population level health outcomes through robust evaluation and research. We'll be recognised as valuable public health experts through ongoing profile raising of the AHP contribution to public health. And effective relationships will exist between AHPs, so those strategic connections and leadership at local and national level to make the best use of AHPs to improve public health and reduce health inequalities. And our expertise will be used to protect and improve the health and wellbeing of the health and care workforce, which is a key priority within a Healthier Wales. So just coming on to the work that has been ongoing throughout COVID, some of this work has stalled, which is inevitable, but we're now able to really probably at a time when we can start to look and pick up some of this work again. We have managed to keep going and have our meetings throughout COVID, quarterly meetings. But this is where we're at with some of the work around these the goals in Wales. So in terms of developing the workforce and demonstrating impact, we've recognised the AHP Advanced Practitioner Diploma had public health and wellbeing learning outcomes and provides an opportunity to promote uptake of that unit. And 2 higher education institutions are starting to recruit to this. It's an optional unit, 10 credits at level 4, and there's an opportunity to promote the uptake, hopefully working alongside those HEIs. There's also an opportunity to build public health into level 3 qualifications. And starting with the Rehabilitation Support Worker level 3 diploma qualification, which is currently under review, there's an opportunity to input those public health competencies at that level. We're looking at CPD opportunities for public health knowledge and skills development aligned to the public health knowledge and skills framework, so that there are opportunities then at all levels of the AHP career framework. And this includes advanced practice and extended skills credentialing, which is being led by Public Health England and is something we are keen to learn from and to share. And there's opportunities in Wales for us to look into perhaps utilising Agorad Cymru units at level 7 for that. And we're also inputting to the review and update of the Council of Dean's guidance for public health content within the pre-registration curricula for AHPs. So this is undergoing review at the moment, and we've been working on that on a 4 nations basis. So for impact, we have submitted an example of public health work to a UK research project looking at how public health is embedded into clinical services. We have got representation and demonstrating our impact in terms of prevention and management of chronic conditions, rehab and recovery post-COVID-19 at various high-level task and finish groups, and also working with the Wales School of Social Prescribing Research to explore funding opportunities for AHP public health research. And there's potential to link in with CAPA, with the Council for AHP Research, with the Wales Hub. In terms of raising our profile, we have AHP representation on the Healthy Weight, Healthy Wales Implementation Board and various subgroups below that, including the Digital Products Development and Content Assurance Group. We have a Speech and Language and Communication national role, or national coordinator role, seconded to Welsh Government, overseeing the implementation of Talk With Me, which I'll talk a little bit about later on. We have been able to, there have been public health project of the Advancing Healthcare Awards for HPs and healthcare scientists for our Wales Awards, with some fantastic projects inputted there. And those included presentations and poster presentations on the day, including podiatry, optimising public health outcomes, speech and language therapy, early language development, and the school holiday enrichment programme coordinated by dietitians. There are also examples of public health work that have been submitted to the Bevan Commission and accepted as exemplar projects, which has been exciting. And in terms of strategic connections, again, speech, language and communication coordinator role in Welsh Government has really been able to input in that sort of cross-sector awareness raising and training and promoting the importance of early language development, aligning to these framework goals. There is a commitment for a national AHP lead post for public health and prevention, and the appointment to that post is not very far away, and so that's a really exciting development where we will be able to, there will be that dedicated time and that dedicated post which will involve overseeing this strategic development in public health. And opportunities for collaboration with input to the primary care strategy, health and wellbeing work stream, some of the work that you just heard Kerry mention around really embedding and working with those communities, understanding their needs and being able to support communities to find solutions to some of those issues that they may raise. There's opportunities to link with the higher education subgroup for the Welsh AHP Committee, with Public Health Wales Effective Employee Wellbeing work stream and the COVID-19 rehab framework. And then finally, with workforce health, staff wellbeing subgroup was established of our public health strategy group, and that's chaired by Paul Dunning. And then Paul also sits on and represents the public health AHP strategy group on the Wales Effective Employee Wellbeing steering group, and that's chaired by Samantha Learwood in Public Health Wales. And the group has drafted a report to showcase the role of AHPs in health and wellbeing of the workforce and work-based services. And there is involvement in the development of staff wellbeing pathways for frontline workers during COVID. And I'll mention that a little bit more towards the end as well. And just to say, in terms of resources that are available to help and support that shift towards embedding public health into clinical services, the Allied Health Professions Hub has a wealth of resources to support all our allied health professionals across the UK. And the aim of the Hub is to provide information, encourage best practice and tell success stories of professionals who do incredible work every day to protect and improve the public's health. And it'll be continuously updated with the latest guidance to support the work of all allied health professionals. And then a further useful resource which has been circulated around managers groups across Wales is this resource embedding public health into clinical services to support clinical leaders and service managers to guide their teams through the process of redesigning services to support prevention. And it's designed as a 5-step process and provides practical tools and resources to help individuals and their multidisciplinary teams identify their unique contribution and then implement quality improvement initiatives to transform services. So just moving on in terms of some examples and some case studies of work that's underway. These slides were kindly provided by Claire Butler, who is the Speech, Language and Communication Lead in Welsh Government. And so in terms of strategic connections and leadership and raising profile, speech and language therapists have a coordinator role where Welsh Government are investing in early speech, language and communication development because it's an important predictor of later progress in literacy. And evidence shows that poor speech, language and communication skills can have an adverse impact on a wide range of children's outcomes, including behaviour, mental health, school readiness and employability. So this is a cross-government plan developed in collaboration with the Royal College of Speech and Language Therapists and aims to ensure that children throughout Wales have access to high quality support at universal population targeted and specialised levels in the early years to develop their speech, language and communication skills. So there are 5 main objectives. Objective 1 is raising public awareness on how will parents and carers be reached with the message. Communication is everyone's business and the importance of talking and playing with babies and young children is promoted. So 10 key messages have been co-produced with Public Health Wales, speech and language therapists and families, and these are being trialled in an Iron Bevan University Health Board. Objective 2 is to improve identification of speech, language and communication needs and ensure children are signposted to the right services for them. The third objective is to provide evidence-based interventions for children with identified needs to support improvements and reduce risk of these needs impacting on their development and well-being. Objective 4 is to upskill the childcare, health and social care workforce to ensure the workforce are highly trained to support children with speech, language and communication needs. And Objective 5, embed speech, language and communication in Welsh Government policies to highlight the importance of speech and language and communication in the early years and beyond. So they're currently looking at outcomes, and these are being collated in Flying Start. At the moment, they're outputs, not outcomes. For example, number of families completing a course, and they now have a multi-agency group utilising the Royal College of Speech Language Therapy guidance for measuring outcomes outside individualised care. And key questions to ask when selecting outcomes, so that a checklist for allied health professionals. So those proposed changes will lead to meaningful outcomes being measured in change in child, change in parent, change in practitioner and change in environment. So a real sort of multi-component, multi-layered impact there. The second example is in public health, nutrition and dietetics. So Nutrition Skills for Life is an all Wales programme where dietitians in each of the health boards and the support workers within their teams, as well as other community support workers who are trained. It builds capacity in communities to enable people to access a healthy, balanced diet, and it contributes towards meeting priorities within Healthy Weight, Healthy Wales, and the implementation of Welsh Government best practice guidance for nutrition for care, childcare settings, and food and nutrition for care homes for older people. Nutrition Skills for Life also underpins the Food and Fun School Holiday Enrichment Programme, and that's coordinated and rolled out across Wales with well over 100 schools taking part now this summer, and that's grown and increased year on year. It provides nutrition education as well as hot meals for children during the holidays and an opportunity for them to have fun with their friends outside of school during the school holiday times. It can be a difficult time for families. It provides accredited nutrition training for frontline workers so that those staff are all confident to pass on those evidence-based nutrition messages to those they work with. It provides lifelong learning. There are opportunities for people to gain credit for learning if they're participating in Agorad Cymru accredited courses in their communities. And it supports new community food initiatives to widen access to healthy and sustainable food and promote uptake of Healthy Start. And the whole of the programme is being digitalised for virtual delivery due to COVID-19 so that we can continue to reach communities with the greatest health needs. And the final case study example is the Workplace Health Initiative, recognising that good work is good for health, and Swansea Bay University Health Board OTs and physio multidisciplinary teams provide wellbeing through work in work support services, supporting working people with musculoskeletal problems and commonplace mental health difficulties such as stress, anxiety and low mood. And they've had 2,500 referrals to the programme and supported more than 250 small to medium enterprises, tailoring the programme to meet the needs of each business. And they also provided webinars for employers during COVID-19 and tips and tools for employees on looking after the mental and physical health and well-being. It provides an excellent example of prevention and early intervention in the workplace, supporting employees and recognising, as I say, good work is good for health. It aligns public health messages with the workplace, and you can see the range of webinars provided. And further information can be found via this link. So just to a final slide, and in terms of future next steps. Again, thank you for the opportunity to engage with everyone today. I just wanted to mention that we don't have representation from all AHPs on the Public Health Strategy Implementation Group. We have a core group of enthusiastic individuals, and we've managed to keep meeting, as I say, quarterly in the main during COVID. And Microsoft Teams has made all Wales meetings much easier, as well as attending the UK meetings. All of it's now virtual. But work previously stalled due to COVID-19. So, for example, the Public Health Wales-led Effective Employee Wellbeing Group is starting up again. So it feels a good time to recruit new members to take the work forward. So this is a plea to all professions to check if you have representation on the group, and if not, please could you take this back to your networks to identify a rep, and do get in touch with me. I mentioned there will be a new AHP Lead Post to take this work forward. The post will be part of the AHP Senior Leadership Team in Health Education Improvement Wales. And then understanding our contribution to tackling inequalities and the importance of doing whatever we can, large or small, to tackle health inequalities will underpin all of our work going forward, and it's vital that we prioritise that together. And then upstream, primary prevention of chronic conditions and impacting on the wider social determinants of health, and focusing on prevention of chronic conditions, type 2 diabetes, cardiovascular disease, stroke, musculoskeletal disorders and some cancers. And supporting those healthy behaviours is also a key priority. And we'll continue to promote our work with communities as equal partners through co-production, and to continue to be recognised as an integral part of the wider public health workforce and system.
Great. Thank you so much, Lisa. That was absolutely fantastic. And I don't know if anybody picked up on that sort of age gap for men and women between the most deprived and the least deprived across Wales. Was it 8 years for men and 19 for women? That just seems...
Yeah, 18 and 19, yeah.
18 and 19, it just seems like an extraordinary difference for a developed country. It just feels like, you know, now is the time for us to be thinking more around how we frame the AHP offer for that proactive, preventative, early intervention. And the case studies that you've provided us with, I think, really give us great examples for how we can do that. I think there are so many resources that you've shared today that I'll look forward to us working closely together to try and, increase the amount of visibility that we can possibly have for some of this work. And as Lisa said, if people are interested in being more involved or want to know who their representative is, please use the email address that we used earlier, and we can filter emails through to Lisa to make sure that you can have access to all of the wonderfulness that's happening around public health at the moment. So without Marie, and I believe, ladies, that you've brought some team members with you, so I'll ask you to introduce your team. But please, I look forward to listening to some of the initiatives that you've been able to take forward around dementia over the last 12 months.
Okay, thank you, Wendy. That's great. So we'll just share the presentation now. And can everybody see that?
Yes.
Yes.
Fantastic. Okay, so thank you all for your time today, and thank you, Wendy, for the invite to present about dementia innovations. So the people presenting today are Nigel.
Hello.
Great. Rebecca.
Hi everyone, I'm Bex Cicero and I'm an improvement manager for adult social care at Social Care Wales. We're the regulator for the social care workforce.
Great. And Natalie.
Hello everyone, I'm Natalie Elliott, the National Consultant AHP Lead for Dementia.
And my name's Rebecca Hammer. I'm one of the Senior Improvement Managers working in Improvement Cymru. So we really value your opinion and ideas about dementia innovation, and therefore we'd be grateful if you're able to connect and participate in today's session. So we've created an ideas board which will provide you in the chat now, and we'd really like you to have any thoughts or opinions or ideas that you feel are important to share with us. If you could pop them onto that board, that would be great. The contributions on the board are anonymous. So that's going into the chat now. But we'd also be really grateful if you could put any ideas or examples or thoughts that you have to share with other people into the chat as well. Okay, so we'd also like to use Mentimeter. So if you could go back to your smartphones, that would be great, or your Google, and pop in menti.com. And is it possible we could have the Menti question up on the board?
Yeah,
that's lovely. So the code was 11557823. And the question we'd like you to answer this time is, oops, here it comes. So what matters most to you about dementia care? Oh, that's great. So some people have already put that in, so that's fantastic. So I'll give you a few moments just to pop your what matters most to you about dementia care.
Here's the code again if anyone wants to use the camera.
So thank you. That's great. So the code's 11557823. So that's great. So majority of you are putting down person-centered, that it's holistic, and leadership and respect are also coming through there quite strongly. And respect and holistic. Oh, holistic is matching person-centered. So that's great. Thank you for those who've participated in that. That's fantastic. So we'll go back to the presentation now. Fantastic. Oops. Okay, so I'm going to hand you to Nigel to talk about dementia care and everybody's business and the importance of dementia innovation. So answering that so what question. Over to you, Nigel.
Hello, good afternoon, everybody, and I'm so pleased to be here to be able to participate on this very issue. Very important because I live with dementia, and it's everybody's business. My dementia is everybody's business. I can't leave my dementia at the door when I walk in, it follows me through. So we understand that everybody has a stake in this. And the dementia standards, which other people are going to be dealing with as we go on, really are a perfect example of how co-production should work. I or my colleagues are also suffering with the diagnosis of dementia will tell you that we've been involved at critical points during the work streams. This has allowed a more nuanced approach to dementia, because if you know one person with dementia, you know one person with dementia. Everybody's different. So every approach to the treatment and care of people with a diagnosis should reflect on that. So often we have to fit around the services, and the services don't fit around us. And the service around the individual is all about that. It's about people having the services that they require, a nuanced approach at the time which they want it. Get it right for dementia and you get it right for everybody. Now, you can't change my dementia. You can't do that. But you can, with my help, together, we can change the world in which I live, which go a long way to alleviating the effects of my dementia. Have a great afternoon. Thank you so much for this opportunity.
Thank you, Nigel. That was great. So there's lots to think about for people on the call today. So that leads me to the whistle-top tour about the Dementia Pathway Standards and your opportunity to participate and tell us your opinion and ideas about any innovations that could support people living with dementia and their carers. So we can get a measure of people's awareness about the Dementia Care Standards work, we'd be grateful if you could go back to menti.com and type the code 11557823 and just answer the question for us, are you familiar with the All Wales Dementia Care Pathway Standards, yes or no? If we could go back to Menti, that would be great. Thank you. Okay, so that's great. Thank you for participating in that. So mainly no, so that's great. Okay, so hopefully you'll know a little bit more when we go through this. I'll go back to my presentation. Okay, so in 2018, the Welsh Government launched the Dementia Action Plan, and this set out a clear vision for dementia care in Wales and outlined many actions, identified multiple services, organisations and communities to work together to achieve this. One of these actions was for Improvement Cymru, who were previously known as 1,000 Lives, to work with all stakeholders in developing a consistent, clearly understood diagnosis, care and support pathway, which incorporates standards of care and outcome measures. And the purpose of developing this set of standards is that people across Wales can be assured that services they receive are effective, efficient and equitable, no matter where they lived. So over the past 2 years, we've taken time to scope, learn and understand what matters most to people receiving, delivering and connected to dementia care across the different areas and parts of the health and social care, voluntary and community systems in Wales. We delivered workshops, meetings, task and finish groups and connected with conferences in Wales and the UK, taking all opportunities to engage with a range of stakeholders and most importantly, people living with dementia, their care partners and families, and also providing services and connected to services. Our approach included appreciative inquiry, along with sharing significant experiences and stories to explore what went well, what we need to build on, along with what can be improved, developing a shared value and a common purpose. Popped into the chat is the Magic Moments in Dementia Care Learning resource, which outlines one of the methodologies we used. It also has some exercises that teams might want to consider participating in to collect their own magic moments, no matter what services they're working in. And so, in total, we connected with over 1,800 people and we've co-produced over 100 potential standard descriptions. 20 of these have been prioritised and aim to better support the person at key points of their journey. 4 emerging themes arose in the development of the standard descriptors, and these were accessible, responsive, journey, and partnerships and relationships. The standards will be dynamic in nature, and as we achieve each of these, another standard will be introduced to further support the person's journey. We are now formalising the standard descriptors into standards with detailed rationale, evidence base and measurement indicators. During this work, people told us what was most important to them throughout the stages of their unique journey, and that any and all experiences must be underpinned by kindness and understanding. So the 20 standards sit within 4 themes: accessible, responsive, journey, partnerships and relationships. And these are underpinned by kindness and understanding. Our aim is to work with communities, assisting them to undertake real engagement to get to the core of what people say will really benefit them. We often hear quoted, "What does care look like around here?" But we rarely gather the right intelligence or deliver real co-production. So how can we say we know what care looks like around here? With this set of standards, the aim is for regions to be offered the time, the resources and the tools to deliver real engagement and co-production to achieve care wrapped around the person, but also care wrapped around the community by the community itself as integrated care. The theme of this webinar today is accessibility and responsiveness. The success of this may rely on partnerships and relationships that we make across regions, communities, services and pathways to support the person's journey through the system. As a point of reflection, we would like you to consider your partnerships and relationships with other areas, services and communities in supporting better outcomes for people. So in the spirit of continuous improvement, we would like you to consider the AHP Workforce and whether this is truly accessible and responsive to people living with dementia's needs. Is there anything you could be doing to make these relationships and partnerships even better? Over to you, Natalie.
Thank you so much, Rebecca. So we're going to put a copy of the Dementia Pathway Standards into the chat so that those people who aren't familiar with the document will have a chance to have a good look at that. Due to time, we've just picked out some of the standards that we're going to discuss in more detail today. It's important, as Nigel said, for us all to be familiar with these because dementia is every AHP's business. We really need you to think about how these relate to your particular role and your service. Next slide, please. Thank you. So if we start with standard descriptor 1, this is all about communities and it connects with the primary care strategic programme that we've heard about already from Kerry and colleagues. And reiterating that dementia is everybody's business, we really do need to build partnerships to make sure we're accessible and responsive to what our communities need. During the consultation around the Dementia Care standards, ideas put forward were including the idea of a community-based dementia hub that can function as a central place to connect and receive support and assistance. A place where peer support and social prescribing can flourish, a place with a one-stop shop approach able to connect with its community. People living with dementia have been hard hit during the COVID pandemic, and we're going to put some stats from the Office of National Statistics also in the chat box for you to have a look at. People have experienced changes to their routines, and we know for people living with cognitive impairment that routine is actually one of the things that can often really help them. So disruption has caused lots of challenges. They've also experienced changes to their access to social networks and to care services. As a result of all of this, people living with dementia and their families have been reporting significant deconditioning, affecting both physical and cognitive skills. Some people have also been feeling very anxious and frightened about re-engaging in activities, about even leaving their homes and getting back to community life. One of the positive aspects of the pandemic is that it's brought communities and services together, strengthening partnerships. And it's also been a catalyst for innovation. Innovations in dementia care that aim to help people get back to activities and community life include the Get There Together project, Back to Community Life project, and also Social Care Wales have developed web pages that contain dementia and COVID-19 resources. And we're going to again be putting more information and links about these projects and resources in the chat box so you can find out a bit more. Thank you. So standard descriptor 5 is all about what should happen before referral to memory assessment services. It is expected that, where indicated, a range of interventions and assessments will have been completed before referral to aid the diagnostic process and ensure that the person has access to the right services and support. Standard 6 also contains a list of interventions and assessments to be undertaken during memory assessment and diagnosis. Interventions are listed to ensure people get the same standard no matter where they live in Wales. So we'd like to ask you to consider these two standards and what you feel is the AHP potential in supporting pre- and post-diagnostic support. We'd like to invite you to put any thoughts and ideas in the chat box or use our ideas board, which will stay live if you're watching this as a recording. So, mild cognitive impairment is an area of focus across many of the standards. And Standard 8 ensures that people with mild cognitive impairment, or MCI, are connected into the right services and know where to go for support. It also has a strong connection to public health, so we're focusing on health promotion and dementia prevention, and it is possible to prevent dementia. We are working with Worcester University, Professor Dawn Brooker and consultant Kerry Phipps to develop an all-Wales health promotion and dementia prevention resource. We'd also like to ask if you've got any thoughts or would like to be involved in this work, please pop this in the chat or use the ideas board. Moving on to Standard 9, this is about what happens after diagnosis, and we're developing an all-Wales resource with a range of interventions and programmes that support partnership working across agencies to provide robust post-diagnostic support. We have physiotherapist Andrew Klein, who's on the call today, who is working with us on Standard 9. And we've uploaded a poster that Andrew's created into the chat along with his contact details. So please do get in touch with Andrew if you'd like to find out more about this piece of work. And I'm now going to hand over to my colleague Bex Cicero.
Thank you, Natalie. The next standard we wanted to draw your attention to is standard Descriptor 10. And this one is really around focusing on the education and skills needed for the person living with dementia and their carers and families. So doing a bit more to recognise, I guess, supporting and developing the expertise in a bit more of a structured and formalised way. And currently we're working on an all Wales resource to support regions to deliver against this standard. And that work at the moment is being led by the Cardiff and Vale Dementia Learning and Development Team in partnership with Improvement Cymru. So if you would like or could be involved at all with any of that work to develop an all Wales resource that focuses on that, then please get in touch with Emma or with Michaela. I think the contact details will be put into the chat now. And the next standard that, again, we wanted to sort of pick out specifically was around the development of a dementia-friendly hospital charter for Wales. So naturally driven by a lot of feedback from people around their experiences in that hospital environment, and trying to introduce a sort of more a set of standards really and aspirations to work to within a hospital setting. That's been sort of developed in partnership with people living with dementia, other key stakeholders and statutory bodies, and it's being led by the Dementia Action Alliance with input from Alzheimer's Society Cymru and Improvement Cymru. So that's going to be launched later this year, but the stage of development that we're looking at now is really to understand how that can impact and make a difference. So we're currently working with Dawn Brooker to look at the VIPS model as a way to sort of understand and look at the outcomes we want to achieve. And then how do we enable people to connect and share practice around that? So we're looking at using sort of the river diagram approach to connect people together so they're able to support each other in practice, to be able to share how they're going with those standards and share their practice and their experience as well. So there should be a link as well, again, in the chat to give you a little bit more information about those approaches. And there will be a task force identified as well for each region to support that implementation of the charter. And again, we'd like to sort of raise awareness of that and the opportunities for allied health professionals to be a part of that work as well. Currently, that's all being supported through the All Wales Dementia Care Inpatient Practitioners Network. So that is a group of practitioners from across Wales who are sort of frontline working in a hospital setting. So again, if that feels like you, we'd love to hear from you and have you involved in that work as well. And we'll put Rebecca Hanmer's contact details in the chat, so do get in touch with her if you'd like to be a part of that. So the next standard, again, that we wanted to draw your attention to was around the concept of more sort of equitable support and relevant support for people. I think that goes back and speaks to a lot of the themes that you've been talking about today, and making sure that there is more equity in some of that more specialist support, and as well some of the awareness around it. I just wanted to share with you one of the pieces of work that Natalie Elliott and myself have been doing around this, which is a dementia support service for all Wales called Ask Us About Dementia. There may be some of you on the call, I can't see everyone, who have been involved as practitioners within it, or hopefully have heard about it. But essentially that is a video consultation, video appointment service, which connects people who are family carers or care workers working with people living with dementia to access more specialist support and to connect with allied health professionals, particularly in the range of support that they can offer using telehealth. So we currently use the Attend Anywhere platform. And one of our aims with that was really to increase the awareness of allied health professionals across Wales and improve access to their expertise, but also to support that peer learning between health and social care practitioners as well. So the model does work on more of a coaching approach, more of a bring in an idea or bring an issue that you're dealing with, and you get a half-hour one-off appointment with any one of our specialist practitioners, which range from occupational therapists, dietitians. We've got audiology on there as well, and we've got some from palliative care social workers from social care. So it's about that connection there and peer learning. And what we found so far in our first phase of this is how practitioners have really benefited from being a part of that transdisciplinary sharing of skills and knowledge and multi-professional working, and how that really can result in a more holistic offer of advice really to people living with dementia and their families. We're currently moving into phase 2 of that pilot. So again, we would love to work with more allied health professionals to either be involved with us as practitioners who would like to join us and try being a practitioner on that service, and also just to get your views and feedback on how we can really enhance that awareness of allied health professional using more innovative sort of pilots and services such as this. So I think someone should put myself and Natalie's contact details into the chat then. So the last standard that we wanted to draw your attention to was around learning and development. So this really standard is about driving learning and development across the health and social care workforce for people living with dementia. And we did want to quickly ask you one question, last Menti, I promise, which is how many people are really aware of the current framework that's out there at the moment to drive dementia learning and development across health and social care. That's known as the Good Work Framework. So we'd just like to quickly ask you to jump back on Menti for one more final push and let us know, yes or no, if you've heard about the Good Work Framework. So give us an understanding really of how much work we need to do to raise awareness of that. So this should be now in the chat, I think. Yep, there we go, the voting for the Menti. Just a reminder, the code is 11557823. And immediately we can see there's a huge amount of awareness then about the good work framework, which is good in a way, because one of our sort of aims with the national work that we're doing is to raise awareness and see how that can support and links to other sort of learning and frameworks. So it's not to detract from specialist work that people do around learning and development, but it's to connect it in so that we got the same principles and drivers and ethos really about how we're working with people, which is entirely familiar with everything you're doing as AHPs and should hopefully resonate with you. So just to raise awareness that there is a national group which links in with the Dementia Allied Health Professional Network as well, to look at dementia learning and development. If anyone does want to know more about that group, I think there should be a Padlet dropped in the chat now, which give you a bit of background, but do get in touch with me if you would like to have any involvement. We also run a network of dementia learning coordinators. So if you're involved in delivering any learning around dementia, there's an open invitation to join that network where we just share ideas, share practice, and also identify if there's gaps that maybe we can connect with and work together on as well. So this final slide just gives you an oversight of all the working groups that are currently driving this activity nationally. Again, just to raise awareness for you, there is an Allied Health Professional Dementia Network, so if people aren't connected in with that, do get in touch with Natalie about that. There's the Inpatient Practitioners group as well, so please get in touch with Rebecca about that, and the broader overarching group for learning and development chaired by myself and Improvement Cymru. Please get in touch if you are at all interested in being a part of that group as well. And just to reiterate with that, a lot of the activity is being driven regionally through regional dementia strategies. So if you are linked in with your regional dementia strategies, you should pick up some of that work there. If not, please get in touch with us and we can try and make those connections for you as well. So all this left for me to say thank you so much really for your time today. There are all our contact details if you'd like to speak to us more. I know it's been a bit of a whistle-stop tour on a huge piece of work, but thank you so much for your time. The ideas board is still open, so if you get any flashes of brilliance after the meeting, and if you are watching this on recording, you can still continue to add your thoughts to that ideas board as well. So thank you very much for your time.
Thank you so much. What an amazing presentation. I think it's just extraordinary how much work is currently taking place within dementia at the moment. Now, I know that the programme said that we were going to have time for a panel discussion at the end of those presentations. And I think one of the key pieces of learning that I've taken away from today's webinar is we've got so much to say about how much amazing stuff is happening across Wales that actually perhaps we need to have fewer topics per webinar to give more of that opportunity for chat. Perhaps build in a little bit more opportunity for chat rooms and discussion topics and various other things. So I think in future webinars, we may look a little different, but give a little bit more time for that interaction, because I think, and I'm just going to put our contact details back up again, because I think that one of the most resounding feels that I got from today's discussion was about getting involved. This is not about waiting for permission. This is about seizing the day, the time, the hour, the moment, the heartbeat that you have to actually think a little bit about where you're placed and what your potential is to make a contribution to the innovation and evolution of allied health professions practice within Wales. I just wanted to pick up on a couple of the comments that were in the chat bar as we were going through some of the presentations, and I think it's quite clear that we have a wealth of knowledge and skills and experiences. Now, we may not know even within the allied health professions how much is going on and how much potential there is for our colleagues to work or make a contribution to our area of practice. So I guess in summary, I would put out a plea to think a little bit more about who else could be involved in the work that you're doing. Reach out to other professionals, people working in settings that you wouldn't necessarily automatically think of, and invite them in and have that conversation. Don't forget, our care needs to be wrapped around the individuals. Thank you so much to Nigel for coming and speaking to us today about his experience. And he said it very simply, our services are not wrapped around individuals' needs, and he has to continue to chase and find services that meet his needs. And I don't think that means that we are where we want to be. These webinars are our opportunity. They are our springboard to work together in a single direction. We can be using that population information to really charge our services so that we know that we're providing the best value, meeting what matters to the people in our communities. We also need to think better. There was a few comments about how we communicate with our colleagues outside of the allied health professions. So if we don't all know what each other does, we could be guaranteed that folk outside the AHPs don't know what we do either. So there is a huge piece of work that we need to do about sharing all of the amazing stuff that we've got to do. And in the last 60 seconds, I'm going to stop sharing this screen so we can put the very last Mentimeter up so that we can get a bit more of a feel for what are the topics that you're going to want to hear about going forward through these webinars. What is it that you would really like to see more from in those future sessions? And it's really great to see so many people have contributed already, and clearly we have an outstanding ask around leadership. How do we work at the top of license, impact and outcomes, sharing of success, absolutely, looking at direct access, and perhaps a bit more of a spotlight on some of those clinical areas like cancer and musculoskeletal practice, and how we can actually look at, and fascinating to see international trends. So thank you all for contributing to that. One last question, yes or no? Well, kind of yes or no, but I guess I'm curious to know whether this webinar has been helpful for actually helping your understanding about the AHP framework and what it's trying to achieve. So I'm just asking, if before everybody takes off, please just answer that one last question. You've got our email address, you've got our website, you've got the hashtag. Please make sure that you keep in touch. And thank you all so much for your participation this afternoon.